on Aristada. Hi, my name is Carol Massey, and I'm going to be doing my medication presentation on Aristada. Aristada is a intramuscular injection, and it is a form of aripiprazole known as aripiprazole Loroxal. Aristada was approved in 2015 by the FDA for use in adults with schizophrenia. It has 4 doses, 441, 662, 882, and 1064. The 441 and the 662 and the 882 are 1-month dosage. The 882 can be used over a 6-week period. The 1064 is a 2-month injection. The cost of the medication without insurance is around $2,000, but it is approved by Medi-Cal. Aristada dose 441 can be given in the deltoid muscle. The other doses are all given in the gluteal muscle. It is suspended in microspheres and time released over the month or the 2-month period. It can be used for major depressive disorder, bipolar mania, autism, and Tourette syndrome. The FDA has approved it for adults except for elderly over age 65 and those with the dementia-related psychosis. It's also not intended for children under 12. The medication works on the D2 dopamine receptor. It's a partial agonist, and it increases mood. It also works on the 5-HT1A as a partial agonist and decreases aggression and impulsivity, but increases sociability. It also is an antagonist for the 5-HT2A and increases mood. There should be diagnostic testing done prior to using the injection. You want to test liver and kidney function tests and other ones such as A1C, lipids, white blood cell count, body mass index, and blood pressure. You would continue monitoring these values while the patient is on the medication regimen. For women who are pregnant, the 3rd trimester is a difficult one for them to take this medication because babies who are born after having had this medication during the 3rd trimester go through withdrawal symptoms similar to EPS. And also it crosses over through the breast milk. So if you're breastfeeding, it's not good to continue to take this medication. You also want to test the client with an oral dose of aripiprazole prior to taking this medication to make sure that they were not allergic to it. Aristada Initio was approved by the FDA in June of 2019. It's a 675 milligram intramuscular dose. This eliminates the need for the 21 days of oral aripiprazole that was required prior to injection of Aristada. So when a client is prescribed one of the 4 regular doses, they can receive that dose plus the Aristada Initio dose of 675 and a 30 milligram PO medication. With these 3, they are now fully therapeutically dosed and would have to have, prior to this, waited several weeks to be at the same levels. There was research done on dosages of 441 and 882, and they were done against placebo, and it showed that the PAN score, which is the test of the negative and positive symptoms of schizophrenia, it shows that they were decreased, primarily the positive effects being decreased, with little side effects of only insomnia, restlessness, anxiety, and headaches, all of which could be mitigated by the use of over-the-counter medications or other home remedies. This research was statistically significant. It showed the placebo had initial response that showed some decrease in the PAN score, but it leveled off. The other two doses, the 441 and the 882, showed a significant decrease in the PAN score after taking the medication for 3 months, and the 882, being the higher dose, showed more of a decrease. There are certain drug interactions to be aware of when taking Aristada. If you're taking certain blood pressure medications, it increases the hypertensive effects and therefore can lower significantly your blood pressure. Also, if you're taking benzodiazepines, it can increase the sedative effects of the medication as well as causing orthostatic hypertension. So be aware of that. You will have an increased risk for falls. Be careful if you're driving or if you're taking care of elderly people or children. Also, it can increase suicidal thinking if you're concurrently taking it with an antidepressant. There are some things to be considered when taking this medication that might be contraindicated. Poor metabolizers, CYP2D6, have to be aware of the potential for toxic levels of this medication, so blood levels need to be monitored. Also monitor those with hepatic or renal conditions. No dosage changes are necessary, but just monitor the blood levels of the medication and adjust dosages if needed. And it's a strong 3A4 inducer and inhibitor, so monitor the blood levels of medication for these clients, both for toxicity and also to see if the medication levels are high enough to be effective. Aristada can have some adverse side effects or reactions. It has increased mortality with a black box warning by the FDA for clients with dementia-related psychosis in mostly age 65 or older. It is known to cause or exacerbate cardiac problems. You want to watch for clients with arrhythmias, bradycardia, AV blocks, strokes, seizures, and those with prolonged QT. It has metabolic syndrome effects, which can be increased A1C, blood sugars, increased weight, high lipids, and cholesterol. Also, it causes difficulties with body temperature regulation, which can affect thyroid issues. Have to watch for hypotension. When administering Aristada, you have to make sure with the syringe that you tap it 10 times at least to dislodge any of the microspheres that it might have accumulated in the cap during storage. Also, you need to shake it vigorously 30 seconds or so to make sure that it's well mixed before injection. And the medication needs to be stored at Fahrenheit temperatures of 59 to 86. When administering the medication, it needs to be rapidly injected, or else the medication can clog where the syringe meets the needle. If that happens, then you need to put on a new needle and re-inject into the client. This can be uncomfortable for the client, so you want to make sure you educate them prior to injecting to let them know that the medication must be given quickly and injected rapidly. Once it's in the body, the medication goes through a period of hydrolysis and becomes the form of aripiprazole. Patient education for clients taking Aristada should include reminding them to not skip their appointments, to come in even if they can't make it that day or the next day, because the medication will trail off, symptoms will begin to return, and so we want to keep a therapeutic level going. So remind them to make those appointments. Also, don't let them not come in because they don't want to experience any side effects. Encourage them that many of the side effects can be addressed with simple remedies or changing dosages. Those are things that can be done to help them with the common side effects, such as restlessness, insomnia, and headaches. They want to alert their psychiatrist if they're experiencing more intense side effects, such as suicidal thinking or aggression, impulsive activities such as gambling or spending too much money, facial movements, confusion, nausea, weakness, rapid weight gain. Some of these the psychiatrist will refer you to the ER for, but you definitely want to go to the ER with ones such as shortness of breath or swallowing difficulties, edema that's occurring over a few hours, any tightening of the jaw, high fevers, a rash around the trunk, rapid pulses and high blood pressures together. And if you are having suicidal thoughts that you cannot control, or you're having a plan associated with it, then you definitely want to go in the ER as well. Here are my references, and I thank you for listening to my presentation.